Hello, and welcome to today's webinar, Leveraging Technology for Aquatics Risk Management. Now more than ever, organizations are looking for better ways to manage risk and ensure safety at their facilities. The last thing they want to worry about in the face of a public health crisis or potential litigation is whether their aquatic team has followed the proper procedures for documentation of safety requirements. Many organizations are turning to software applications for the digital management and documentation of maintenance issues, inspections, water chemistry, staff management, certifications, and training. In this session, we'll present how digital tools can be used to improve risk management and safety in a cost-effective way. Hello, my name is Rich DeMayo, Director of Web Applications at Councilman Hunsaker. And today, we'll be covering top issues for the aquatics industry, how digital technology can help with those issues, the cost effectiveness of digital systems, and we'll wrap up with our conclusions. A little bit about these items. We want to start at the beginning in terms of what are the top issues or challenges for the aquatic industry as determined by the industry. Then we want to get into some digital solutions and how they can address those issues, and ultimately cost effectiveness. In the long run, a digital system should not cost you money, it should actually save you money. So we're going to talk a little bit about that in terms of a little case study that we have here as well, and then we'll wrap up with conclusions. So let's start with top issues for the aquatics industry. This slide is based on a report done by Recreation Management called their Aquatics Trends Report for 2020. They do this every year. It's basically a survey of professionals in the aquatics industry. And from that report, they identified the top challenges for the industry. These are just the top 4. The list actually goes on from here, but we're going to focus on these. The other thing I'd like to mention as well is this report was done actually before the occurrence of COVID, around February or so of 2020 is when this was published, I believe. But COVID actually affects it. I don't think it changes it, but it does affect it. So we'll talk a little bit about that as well. So I want to start with staffing. Staffing is always a top issue. Whenever you talk about challenges in the aquatics industry, staffing is important, especially as it relates to staff such as lifeguards. It's a skilled position that is notoriously low compensated, and it's always a challenge to hire guards and to ramp them up and keep them trained. So readiness is really going to be important, and especially now during COVID, with facilities closing and reopening and closing and reopening potentially again, it's going to be really important to keep that staff up to snuff as it relates to risk management techniques and lifeguarding techniques. Second item on this list is budgets. Budgets are always a big issue in the aquatics industry, and it just seems like expenses go up faster than our budgets will allow. In fact, I believe on the report, they said budgets between 2018 and 2019 went up, or I'm sorry, costs went up by over 10%. And budgets in these times with less revenue coming in due to COVID are just more constrained than ever. So it's always going to be a problem, but it's especially a tough problem right now. And then the third item here is facility maintenance. We always have to do maintenance. During normal times, we're doing maintenance on our facility. With COVID, maintenance requirements are actually always changing. For example, cleaning and disinfecting is something that's going to be critical in terms of facility, and those requirements will change over time. So the important thing is to have a flexible ability to react to changes in your maintenance requirements. The other thing that's occurring is a lot of folks are doing maintenance while their facility is closed, and then when they open up again, they're going to have to change their maintenance requirements to deal with an open facility. Those changes need to be seamless. And so facility maintenance is important, but it's important now as much as ever. And then finally, the last one on the list is safety and risk management. And safety and risk management is kind of all encompassing. And it's always important. We're always managing for safety, and we're always wanting to reduce our risk. These days, we're also having to respond to enhanced regulation and compliance requirements, particularly around the pandemic. We're having to react to changes in CDC guidelines, state and local health codes, and even our own procedures. So, in dealing with safety and risk management, it's just even that much more important that you have the flexibility to react to change. That's key, and to be current on the current requirements and to be addressing those requirements properly. A couple of the things that are new, for example, are managing social distancing and contact tracing, and we'll talk about that a little bit later. But these are the top issues, and they're the issues no matter what. But the topic of our presentation is how digital systems can help with these issues. So that's what I'd like to talk about next. Well, certainly capturing the right information is going to always be important. And digital systems can help with capturing the right information, because if you have the required information come up on, let's say, your tablet or your cell phone, let's say you're doing an opening checklist or a maintenance checklist or something like that, if you have the proper requirements coming up on your device from a technology solution, you're going to perform the right things. As things change, it's really important to be able to change the requirements real time so that people always are working to the right set of requirements. So that's going to be really important, and capturing the right information is part of that. Implementing best-in-class standards, whether it be the Model Aquatic Health Code or your state and local health codes, you're always going to be wanting to implement the best-in-class standards to maintain a safe and risk-free facility, or low-risk facility, that is. And a digital system can help with that as well by updating those standards real time. So you can be sitting, let's say, in an office on your laptop, and you can update the requirements for people to follow. And with a digital system, they're all going to have that set of requirements instantaneously on whatever device they happen to be using. So that's going to be really important. Managing staff. How are you managing training? How are you managing certifications? How are you tracking that? How are you making sure that the right person is on the right shift with the right skill set? A digital system can help with that, and we're going to talk about that a little bit later as well. And then managing risk in general. How are you reacting to the COVID-19 situation? How are you reacting to distancing and contact tracing? How are you reacting to having to reopen and close your facility and reopen it? Those are all things that digital systems can help with. And then finally, I want to talk about controlling cost. Controlling cost is more than just reducing the cost that you have. It's actually using a digital system so that in the long run, the digital system saves you money instead of costing you money. Sure, there's going to be upfront costs associated with subscribing or licensing the new system that you might use, as well as a little bit of ramp up time and training so that you're using it properly. But in the long run, a quality system should save you money. It shouldn't cost you money. And so we're going to talk a little bit about that later in the presentation. And then finally, overall, flexibility and agility is the key, right? You want to be able to react to changes in requirements, changes in safety requirements, and changes in risk. COVID-19 is a great example of this, but it could be anything. That flexibility and agility is going to be critical to being able to react and making sure that you're doing the right thing. This is where a digital system is unparalleled in the ability to help you update your requirements so that everybody is working from the same sheet of music all the time. So I want to talk first a little bit about just managing risk in general. So when we work with our customers in terms of risk management, we talk about three primary things. We talk about tracking, we talk about training, and we talk about prevention. From a tracking standpoint, it's really important to keep quality records, because you always want to be able to refer to these and use these to make better decisions going forward. So you want to track things like, how are you operating your facility? Are you doing all the right opening and closing procedures? Are you doing the right maintenance? Are you tracking all your certifications properly? Are you making sure that all your lifeguards, for example, are qualified? Those are important things from a tracking standpoint. And tracking properly means that you're going to actually implement things properly. Training is so essential to managing risk, whether it's orientations or onboarding, internal trainings like in services, or just customer interaction training. Training is going to be critical to running a safe facility. And then finally, we have prevention. Well, obviously, if you're tracking things and training properly and you have a good education system in place, you're going to be much better positioned to be able to prevent costly incidents. And then there's the basic blocking and tackling of signage and rule enforcement, which we're all going to do our best to perform. So I want to talk a little bit about capturing the right information. So, the old way was with a clipboard and a pen and paper, right? And some key questions come up when we talk to clients if they're using kind of an old antiquated system or just pen and paper and just filing things in a binder. How can you be sure that you've documented everything that you need to document, right? Is that pad of paper telling you what the right things are to document? Let's say you have a paper form that you're supposed to fill out. Let's say, you've given everybody paper forms. How do you know that everybody has the current paper forms? They're being updated constantly, right? Is it easy for you to detect deficiencies and correct them? Like if you write down a deficiency on that form, how does that get communicated to the person that has to fix it? How efficient is that, right? Can your paperwork or data be lost or destroyed? We had one customer that we were working with, and we asked them, well, where do you keep all your documentation? They said, well, we keep it behind the climbing wall next to the pool. So they had boxes and boxes of paper documents behind the climbing wall next to the pool. What if there was a leak that could destroy the documents or damage the documents? Or what if things just got lost because you're filing everything in paper? Can you easily find what you need? That's the next question. And how much time and money do you spend documenting and accessing the information? The key here is accessing. It's one thing to capture the information and store it somewhere. It's another thing to access the information and to be able to access it and to take action on the trends that you find. If you have a digital system, not only are you going to be able to capture the information, but the most important thing is you're going to be able to access it, analyze it, and make decisions from it. And that's something that's much, much harder to do with a manual, paper-oriented system. The next topic is managing and implementing best-in-class standards. So whether it be the Model Aquatic Health Code, which is the example I use here, or your state and local health code, or your own processes and procedures, how are you managing those things to make sure you're running a safe facility? Are you doing daily checklists and making sure that everybody's up to date on the current checklist? Are you recording illness and injury reports? If you have incidents, it's very important to document them properly. Do the reports include pictures? Are you taking pictures of the area or of the incident that occurred? And is it easily accessible? Are you doing rescue reports properly? Are you managing chemicals, water chemistry properly? Are you doing your daily chemical checks? And are you maintaining a daily chemical log? All these things are going to be important. The record keeping is going to be really important, as well as the compliance. And how are you going to prove compliance, right? Are you going to dig through a paper binder to show the health inspector that you're complying? Or can you really quickly and easily run a report using a digital tool that says, this is all the things we did, this is when we did it, this is what happened, and I have accurate information and it's signed off by the right people. With a digital tool, you can get that at your fingertips, and I'll show you a little bit about how we do that in some of our demos, which are part of the presentation. In fact, I have a demo here right now. I think this demo is a little bit about reporting and getting the information out of the system and being able to access it pretty easily. I think there are two parts to this. In fact, one is entering the data and one is accessing it. But let's watch it, and I'll try and explain what's going on here. So facility reporting. So it's back basically reporting. With a digital system, you might have charts that show compliance. These are just some basic compliance charts at our facilities. We can look at all facilities at once or individual facilities. And then we have reports in this system associated with water chemistry. Here's a quick and easy trend report on water chemistry over a period of time. And we're looking at, FAC and pH and looking for different types of anomalies or spikes or valleys or anything like that. This is a basic view of a closure report. So why was I closed? And, when were my closures? And do I spot any trends here in terms of my closures? Are there particular types of incidents happening? Right now we're looking at inclement weather closures, but you see the other types of closures that we're recording here. So the important thing here is that with a digital system, you're going to have instant access to all the information that you're recording at your fingertips at any time that you need it. You'll also notice that this municipality that we're doing the demo from, it's the town of Parker, Colorado, just for your information. And that's the instance that we're using to demonstrate our digital systems during the presentation today. So you'll see that as we go through. Okay, the next thing I want to talk about is a little bit about risk management as it relates to COVID specifically. So, primary topics here: maintenance and staff training. How are we monitoring our maintenance, and how are we monitoring our training for our staff during COVID-19? Maintenance is going to change, whether our facility is closed or open. We're going to perform different maintenance based on the requirements that exist at a particular point in time. And then also, one thing that we're seeing from a training standpoint is we're seeing a lot of our customers access blended or online learning to keep their staff requirements up to speed as best they can in situations where maybe the facility is closed and they can't do live training. They can get a lot done through online training, and you can use digital systems to help with that. Cleaning and disinfecting. Cleaning and disinfecting is going to be different during COVID. CDC has particular guidelines, and I think we're going to show an example of a cleaning and disinfecting checklist that the city is using that was derived from CDC guidelines. Social distancing is going to be important. Contact tracing is going to be important. From a social distancing standpoint, there are technologies where you can monitor where people are in your facility and how dense the population is. And then for contact tracing, one of the ways that we're seeing folks manage contact tracing is an accurate recording and an accurate reporting of how your staff was assigned and where your staff was assigned at a given point in time using a staff scheduling system. If you're recording it in a digital system, it's pretty easy to get the reports on who was where and when. And if you ever have to do contact tracing on your staff, you have the ability to do that. And then just generally the flexibility of digital systems, I talked about this before. With COVID-19, we came up with a lot of new requirements and health codes that we had to comply with. And it's real easy to update the things that you have to do in your digital system so that people have it on their tablet or on their cell phone, and they can execute the checklist they have to execute really easy. It's really easy to update that list and for them to be able to access it and use it. if it's digitally managed in the cloud. Maintenance and training, we talked about this on the previous slide, so I don't want to take too much time on this, but with maintenance, can you customize your maintenance checklist to reflect current conditions? Conditions are always changing, right? We're going through it today with the pandemic. If I have a change in maintenance requirements, can I change a maintenance checklist quickly and easily and have all my maintenance people have that checklist right in front of them? Well, with a digital system operated in the cloud, that's real easy to do. You just update the checklist online. They go in and they access it on their phone or their tablet, and they have the right information right in front of them. From a training and certification standpoint, can your system enable the tracking of training and certifications that are done online? If your staff takes a remote course, let's say a lifeguard, when your facility is not operational, they can stay up to date on, let's say, their classroom training by taking online training, right? Organizations like the Red Cross offer this stuff. And then are they able to easily update that, upload that certificate or that proof of completion into your system? And now you have access to that real time. You know who's up to speed and who's ready to ramp up quickly when you can do in-person skills training at your facility. A little bit more on cleaning and disinfecting. This is an example of a cleaning and disinfecting checklist that was implemented at a municipality over here on the right, and it's based on guidelines that updated during the COVID pandemic. So what they were able to do is really easily update this in their system and then leverage it so that they're complying with CDC guidance. You could do the same thing with state and local health department requirements as well. If the state or the local health department has new requirements, you can easily update in a digital system. You can easily update those requirements on a checklist in the system, and then everybody at the facility has the proper checklist going forward. Whereas if you're doing this on paper, for example, if you have to create, let's say, a new checklist for people to follow, a new form that they need to follow, you got to make sure that they all have the right form and they're not working from a wrong form. If you have this all digitally, it ensures that everybody's working from the same form. It's going to reduce your risk, and it's going to make their work so much more efficient if you have a digital system to manage this. Okay, yeah, so we have a little demonstration here, and I think this example is of a cleaning and disinfecting checklist that was developed specifically for the COVID pandemic. So let's run this. Yeah, so it's a cleaning checklist, and what we've done here at the City of Parker they basically updated the questions on their cleaning checklist to comply with the latest requirements, right? So they're putting things in here like, this is a checklist, part of it's making sure guests wear face mask. And it's real easy in a digital system to update these questions, to add questions, to delete questions that you make sure that people are complying with. Now I think we're drilling down into one of these checklists, and here's someone going through the checklist, making sure that they have compliance. Oh, they found one item that has not been complied with, right? Oh, it looks like guests are not aware that they need to wear face masks. So what they've done here is they've indicated non-compliance, and then they created an issue that's going to be sent to a responsible party. You see manager Alondra here is going to be responsible to address this. So we've created an issue, and now somebody has to address it. And because Alondra has a cell phone or a tablet, she's going to be able to pull this up on her cell phone or tablet. She'll get a notification, by the way, that she has to address it, and then she'll be able to pull it up on her cell phone or tablet and address it. So now that's what she's going to do next here. She is in her system and she sees this issue. She drills down on it. She reads it and she says, well, what am I going to do to complete it? And she's going to write down here what she's going to do to complete it. If this was like a physical item that came up, like something needed to be repaired, you could also take a photo from your device and it's automatically added to the list and you can refer to it here. But in this case, she's saying she completed it and the issue is addressed. And you can see the issue under the open issues column here has now been grayed out because it's been addressed. Before there was a blue number 1 there that indicated there was an issue that she needed to address. But she also got an alert for this as well, which we didn't show in the demo. So isn't that much easier than writing it down on a piece of paper, making a phone call, telling somebody they have to address it, physically sending an email? She's going to get an email automatically with the system, is how that works. Okay, I want to talk a little bit about social distancing and contact tracing. This is something new that occurred, and actually some facilities actually have the technical capabilities today to address this. So there is location technology out there that will enable you to track guests' whereabouts. Basically, what they do is when the guest comes on site, they have the ability to give the guest like a little bracelet that has a sensor in it. And what some of these systems can do is they can track the location of the guest. They can track how densely populated a space is so that they can make sure that people are distancing more properly and they're not overcrowding the facility in one particular space. That's really important in terms of the ability to manage that distancing, as well as being able to report on the history and the density of the population in the facility at any given point in time. So it's good documentation as well as good actionable information. On the contact tracing side, I didn't mention it on the previous slide, but I will now. On the contact tracing slide, you know, one of the big issues that a lot of facilities have is around scheduling staff. And so there are applications that exist for scheduling staff. I'm going to show you an example of one here. But these scheduling applications can not only be used for scheduling the staff, which is a really important function to get the right qualified people in the right place at the right time, but you can also use this scheduling system retroactively for contact tracing. For example, if you know, God forbid you had an outbreak at a facility, it's going to be important to know like which staff might have been exposed to the outbreak. And you can use the history in the scheduling system to manage and identify who was on shift in a particular location, and then you know, give that information to the proper authority so they can notify people on your staff. So it's another use of a scheduling system aside from just the very important task of scheduling people. So we're going to run through a quick demo of this. We're going to first fill an open shift. So now we're just talking about the scheduling part. There's an open shift, that gray box, and we're going to look for available people, and there's a person available, and we're going to assign that person shift, and now that shift is covered. But from a historic reporting standpoint, what if we had an outbreak of COVID in the past at ABC Aquatics? Well, we're going to want to produce a report of the shift details that occurred in the past. And here we do have just a very simple report that shows who was on staff, what hours they were on staff, and where, and what position they had. So, you know, this is a very useful tool if you ever have an outbreak. And I'm not aware that, you know, this client had an outbreak, but if they ever did, they have the ability to actually look at who was on shift and when they were on shift to do that all-important contact tracing. The other thing I'll mention here as well is if you're not using a quality digital system, there are all that occur in terms of scheduling. You have swaps, you have absences, all those things. With a digital system, that information can be easily updated in the system, and then you always have a proper history as to who was where and when. So let's say, Melinda here, swapped out with somebody else, you would see the other person's name here, not Melinda. And as long as you're keeping your system up to date with the swaps, which you would with the digital system, the person can request a swap with someone. You're going to have the right information here from a historic standpoint as well. Okay, next thing I want to talk about is managing staff for safe operations. So in order to manage staff for safe operations, it's going to be very important that you have efficient tracking of certifications and all your types of training history in services, internal observations, skill evaluations. Are you maintaining certifications? Do you have a way to find out if certifications are going to expire soon? With the digital system that we're going to see, in fact, it actually creates a notification to let managers and guards know if their certification is coming up for renewal, and it'll do it before they've expired as well as when they've expired. So, if you want a warning, let's say 60 or 30 days out, the system will do that for you. Managing internal observations and skills evaluations and response time tests. This system that we're going to see has the ability to manage all those things and record the results of different types of observations and skills evaluations and other requirements that a guard is required to perform. It also has the ability to insert video. Let's say you take video on your phone, it can be automatically attached to the report for, let's say, a skill evaluation, or photos as well. If you take a photo on your phone of the training and you attach it to the report, it's also recorded in the system and you can access it really readily. So I'm going to run this. This is a demo of a lifeguard management program. So reviewing your staff's training and certification. So we're looking at our staff. Here they are. I can see that I can see all the in-service training that that person has taken. I can see my internal observations that were done at a given point in time. I can see that this person passed their internal observation here. You can easily drill down on this and see where somebody may have failed. It looks like everybody passed this. Internal skills evaluations. Here's an example of a form. There's somebody that failed a skills evaluation. So we want to make sure that they redo that skill and they get an approval, but we can drill down on that and see what happened. It looks like they did not do the 30 compressions properly. So we're going to have to probably do that again with that person, but that information is right here and you're not going to let it fall through the cracks. Here's another example of a certification that's expired. You can drill down and see the physical certification itself because there's a place to attach it here. And yes, in fact, it is expired. And so that person can't be put on shift with the scheduling system, which, by the way, is in the same overall application as the certifications and training system. So having this all in one place is very important. And having the ability to put the right person on shift that's actually qualified is really important on the scheduling side, which we saw before. Okay, very good. So let's move on to the next thing. Okay, the next item I want to talk to is controlling cost. And as I said before, it's very important that a quality system saves you money. It doesn't cost you money. And I'm going to show you some examples here that we did with that particular facility in the town of Parker, where we linked up some publicly available data from the CDC and some other organizations and their own figures to come up with a estimated savings by running a digital system as opposed to not running a digital system. So there are a few areas that we looked at. We looked at improved risk management with respect to the reduction in closures or costly incidents that might occur. We looked at improved staff efficiency from a training, tracking, and a maintenance of skills. We looked at the ease of entering information as well as accessing it. And those last two bullets really refer to the access of information. So it's one thing to get information into a system, but then once you have the ability to get information out in the form of quality reporting and analysis, you now have actionable information that enables you to improve your operations and reduce your risk. So being able to report and analyze issues that come up and performance items that come up, you're going to be able to make better decisions going forward and make your facility safer. So in terms of this little case study, we looked at three key areas. We looked at digital document management and the potential savings of digital compliance documentation and record keeping versus paper, which is what this facility was on before. We looked at risk management, the ability to reduce violations and closures from health department reporting. That's what we looked at specifically, and improve safety and compliance. And then finally, we looked at lifeguarding and water safety and the potential economic cost of a potential incident at your facility. So with digital documentation management, we started with, and I'm not going to go through all these numbers, by the way, we don't really have enough time. But what we did was we looked up some sources of information on digital documentation management. There is an organization out there called Help Systems. So they had some analytical information on the potential savings of digital document management at helpsystems.com. You can see the link here. We also accessed information from another organization called the Gartner Group, which is an industry analysis organization as it relates to information technology systems. And they had some data on the cost of misplacing documents. And then helpsystems.com had some information on potential document management cost savings using digital systems. They even have an ROI calculator on their website, which was kind of really cool. Then what we did was we talked to the folks at the town of Parker about their facilities, and we asked them questions like, what do you think, how much paper did you handle, per year before you went digital? And what do you think your savings was? How much time did you typically spend filing and finding paper documents before you had the digital system? And how much what do you think is reasonable that you saved in time since then? What do you think the costs of human error are? Right? And how often did you misplace a document? How often did you lose a document? How often did you have to replace a document? So basically what we did was we combined their information with that of the publicly available data, and we came up with a potential total savings, and you can see the final calculation at the bottom of this form here, of upwards of $18,000 per year by running a digital system as opposed to having manual or paper systems. The next area we looked at was risk management. And for this, we used a CDC study that looked at routine inspections that resulted in closures. About 1 in 8 routine health inspections actually results in a closure. And we said, well, if you look at that and you say, hey, 1 in 8 inspections are going to result in a closure, whether it's a general safety closure or whether it's related to disinfectant concentrations, i.e. water chemistry, or safety equipment, whatever the cause, if you're able to reduce the number of closures, what kind of savings could that produce? So we used those numbers, and then we combined them with information that we found at the city. And we also looked at some of our own data from working with many other municipalities as well. And we did a quick calculation on what we thought the potential savings of having a digital system would mean in reducing closures per year. We had to make an estimate of like the length of the closure period typically is a day, and that's what we got from the city. And then we estimated what we thought, potential lost revenue based on being closed might cause. And we came up with upwards of $3,000 per year by having a digital system, just reducing closures. We're not talking about reducing other types of incidents. There's probably other savings as well, but this is what we had available to us in form of a CDC study, so this is what we used. And then finally, we looked at general safety in terms of water safety as it relates to lifeguard management. And for this, we used a CDC report entitled Lifeguard Effectiveness. You can see the full report title at the top of the screen here. And the funny thing, you really can't put a dollar value on a human life, but the funny thing is CDC actually did so in this report. And they found that the economic cost savings of having quality lifeguard staff in place at a facility was really significant. I think you can see that the potential economic cost of an actual incident ranges between $200,000 and over $4 million. That's pretty broad range. So these are pretty big numbers they came up with. And this is the CDC coming up with these numbers. These are not ours. So the potential cost savings of avoiding an incident is huge. And the human saving is huge, obviously. Now, we didn't actually do a real example here. We did estimate that for the city at 2 aquatic facilities, they see about 700,000 patrons per year. And based on that, there's potential value of over $3 million a year in having a good qualified lifeguarding staff at the facility in general. So it is a very valuable thing to have at your facility. All we're going to say here is that having a quality digital system to manage that staff's training, certifications, their performance, all those things that you're going to do a better job of it with a digital system than you're going to do with a manual system. And we're not going to put a particular value to this one because the numbers in the CDC study were so very high. It was kind of hard to zero in on what the actual dollar value it is. But I think it's something for you to ask yourself, what's the value of managing your lifeguarding staff and your lifeguarding program more efficiently with digital tools than you might otherwise do with manual tools? And we'll just leave that for you folks to answer yourselves. So with that, by way of review and conclusions, we looked at digital solutions improving aquatic operations. We looked at capturing the right information, implementing best-in-class standards, reducing risk and ensuring compliance, enhancing safety and staff performance, and reducing cost while improving outcomes. Digital systems are the way to go. It's the way the industry is going. And then we went through some demos. By the way, I would be remiss if I didn't mention the applications that we showed today are part of Councilman Hunsacker's Hydro Apps. My name again is Rich DeMeo. I'm Director of Web Applications at Councilman Hunsacker, and I run the Hydro App suite of web applications. It includes 4 solutions, facility management solutions that includes the checklist and the issues management and the pool test and water chemistry. It includes a lifeguard management solution, which is the training, certifications, and skills evaluations, et cetera, for managing a quality lifeguard staff. It includes the schedule management solution, which we saw for assigning the right skilled staff to the right shifts at the right time. And I think I already mentioned it, but I'll mention it again. It includes a pool test application for managing water chemistry at your facility. If you have any questions at all on the presentation, do feel free to ask, or do feel free to write me at richdemeo@chh2o.com. If you would like more information about digital solutions in aquatics, you can also visit www.hydroapps.com. That's www.hydroapps.com. I thank you very much for your attention today, and please do give me your questions. Thank you.
Awesome. Thank you so much, Rich, for presenting to the Community Rec audience. We don't have any other questions at this time. Is there anything else you'd like to add before we end?
Thank you, Rachel. I want to thank you guys for giving me the opportunity to present today. And I'll just reiterate, if anybody would like more information, do feel free to contact me or go to hydroapps.com. That's hydroapps.com for more information about digital systems. But thanks again, and have a great day.
All right, thank you. And thanks to the audience. And yeah, like Rich said, everyone have a great day. Bye.